We'll just get started, I guess. I don't know if I'm waiting for, oh, we got participants. Good. We're having participants join in. I'd just like to welcome you to our first panel forum for COVID. I'm very excited today to talk about vaccines. We have 4 great experts here to talk about them. We've got Professor Neilson, Dr. Johnson, and Dr. Gold, and then I'll chime in as needed, but I imagine these 3 are going to take it away. Today's focus is going to be straight on vaccines, and we're actually going to answer some questions that were shared to us by students. So the questions that we've already established or that we're focusing on are questions that came from students already through classes and that were given to us by a faculty member of most frequently asked questions revolving around vaccines. Keep in mind though, if you would like to, you can still submit questions using the chat button or the Q&A button at the bottom. And if we have time, we'll try to get to some of those. If not, they'll definitely inform any future panel discussions. So as we get started, what I'd like our esteemed guests to do is to take a minute and just introduce themselves, and then we'll go from there. SheriDawn, let's start with you.
My name is SheriDawn Neilson, and I am a critical care flight nurse, and I teach nursing here at SUU. And over the course of the pandemic, I've been transporting COVID patients from rural Arizona and Utah to larger facilities. So when the vaccine came out, I knew I'd have the opportunity to get it in the first few weeks. So I did a lot of research on it and its safety and asked a lot of questions. And since then, I've just kept up on the research and the statistics because I have lots of students and family and friends ask my opinion, and I just wanted to be educated.
Well, thank you, SheriDawn, for joining us today and helping answer some questions we have about vaccines. Roger?
Okay. My name is Roger Gold. I'm in the biology department here at SUU. I am a professional microbiologist. I've been researching and teaching microbiology and immunology for probably over 15, 20 years. You take it all into account. Happy to be here.
Well, thank you. And then finally, Evan.
Hi, my name is Evan Johnson, and I am actually an associate professor of medicine and biostatistics at the Boston University School of Medicine, but I actually live here in Southern Utah, and I teach at SUU as well as an adjunct in the math department. And I'm also a graduate at SUU as well. My research, my training is in statistics and in computational biology. I do a lot of work in infectious diseases, both at the molecular level as well as the clinical level, really trying to understand mechanisms of understanding disease and how it works. We've got several COVID projects looking at peptides in COVID and how the immune system interacts with different parts of COVID. Especially as you develop immunity, as well as looking at biomarkers to try to predict who's going to have a negative outcome in COVID.
Oh, thank you. Well, I'm excited to have all 3 of you here. And again, today's topic is going to be on vaccines. And we have, 5 questions that we've pulled from student questions in classes and from student concerns. And we're going to start with you, Roger. And if you wouldn't mind, take a minute, and how does the mRNA vaccine work? And how is it different from the vaccines that we've had in the past?
Okay, very good. It may surprise you to know, but we've been vaccinating people against viruses for over 600 years. Since about the 1400s, we've been using a type of vaccine called an attenuated or weakened version of live viruses as vaccines. Basically, these weakened versions of the pathogenic viruses are able to infect our cells, but they're less likely to actually cause disease. They are, however, very successful in teaching our body how to recognize and fight the fully pathogenic virus when we encounter it naturally. And basically, by allowing these weakened live viruses to infect our cells, there are 2 branches of our immune system that are activated. The first branch involves B cells. B cells make antibodies. These antibodies are proteins that flow throughout the body, recognize and bind in a very specific way to the surface of viruses and bacteria and so forth, wherever they're found. So if the antibodies are present when you're exposed to a virus, your antibodies can actually bind to the surface of the virus before it binds to your cells and will prevent binding to your cells. So again, antibodies made by B cells basically try to block infection after we've been exposed. The second branch of our immune system involves what are called T cells, and these work a little bit differently. A specific T cell called the TC cell basically flows through the body, checking out every cell of the human body, looking for evidence of its being sick. If they find an infected cell or a cell that's turned cancerous, they try to kill it. Basically, what they're trying to do is to kill our infected cells before the virus or the cancer that's growing inside those cells has a chance to fully mature and spread. So the point of all this is a truly effective response against the virus depends on both branches of the adaptive immune system to be actively monitoring and fighting the infection. And up to this point, the only way to activate both branches of the immune system is to use a live virus. And unfortunately, a weakened virus is still alive, and there's always the chance that it could revert back to its pathogenic form and actually cause disease. Reversion is unlikely, but it always remains a risk. But mRNA vaccines are different. mRNA vaccines don't contain any virus at all. mRNA vaccines simply contain a small piece of genetic material called the messenger RNA, or mRNA, that codes for a single viral protein, or maybe even just a small part of that viral protein. Now, the Pfizer and the Moderna vaccines both use a piece of messenger RNA that codes for different portions of the same protein. It's the spike protein for which the coronaviruses are known. That's the protein that allows the coronavirus to bind to our cells. The vaccine is injected into our upper arm. The messenger RNA enters a few of our muscle cells. And once inside, the muscle cells simply think that that new mRNA is just one of our own mRNA molecules that we've made ourselves. It reads the genetic instructions and builds that portion of the spike protein. The messenger RNA only lives for a few hours, but in that time, it's able to code for many copies of that one specific protein. Basically, because this protein is actively made inside our cells, it's able to activate both branches of our adaptive immune system, both the B cells and the T cells. Our body starts making circulating antibodies which try to block infection, and it makes TC cells that specifically recognize those cells that are actively making the spike protein. So if we're later exposed to the actual virus, the antibodies and TC cells are already present and able to fight the infection very quickly and very efficiently. We're basically immune. I just kind of mentioned, it's kind of interesting. I've been teaching about mRNA vaccines in my microbiology and immunology classes for over 15 years. I've watched the results of lab tests and animal studies for a very long time, and I've actually just been waiting for the day when mRNA vaccines would be available for us. So I really do believe these vaccines are the safest and most effective vaccines we've had in the 600 years we've been vaccinating ourselves, because there are no active viruses involved, and yet we can still express the relevant proteins inside our cells and activate both branches of the adaptive immune system.
Thank you, Dr. Gold. Yeah,
Okay.
one more. Go ahead.
Okay. I just want to mention also that mRNA vaccines actually show great promise in fighting cancer as well. Using the same technology, we can teach our TC cells to recognize cancer cells throughout the body and eliminate them. So it's something I think is very exciting.
That is very exciting. I'm glad we have it now, and I'm glad that there's promise for cancer. That'd be very neat. SheriDawn, Professor Neilson, how effective are the vaccines? And talk a little bit perhaps about the vaccine safety.
Okay. So probably the two most common questions I initially get are they safe and do they work? So the FDA process, a lot of people are afraid that process was rushed because these were able to be approved very quickly. They really weren't rushed. The clinical trials were very rigorous, and they met the criteria that they needed to meet. The two biggest factors in how we were able to get these vaccines out fast, in addition to what Dr. Gold said about it's actually been studied for quite some time. The biggest thing that they have a problem with is usually money and participants in studies. So they were able to use, had a lot of money donated to them, and governments were paying a lot of money. So they had the money that they needed, and there were a lot of volunteers that volunteered for these trials. And so they were able to overcome those two things very quickly and still be able to do rigorous clinical trials. Another really interesting thing that I think is pretty cool about these vaccines is that after the vaccine was rolled out, they introduced a V-Safe program. So when you went to get your vaccine, they enrolled you, if you wanted to, into this V-Safe program, and you used your smartphone and an SMS system to send in data about your symptoms and any side effects that you were experiencing. So for example, when I got my vaccine, I just used the QR code, signed up for VSafe, and then for every day for 1 week, I filled out a survey about my symptoms. And then after that, I went to every week. And then the same thing happened when I got my second vaccine, every day for a week, and then every week for about a month after that. And then I got monthly check-ins, and the last one I have received was at 6 months. This is pretty unprecedented in like data gathering after a vaccine or medication has been rolled out. So we have millions of pieces of data about side effects. Another thing that's pretty interesting and cool about it is that they also asked the question if someone was pregnant. And if they were pregnant, had become pregnant, they would follow up with them. So we actually have a lot of safety data in pregnancy, probably more so than any other medication we've ever been able to collect data on in pregnancy, because it's pretty unethical to test medications on pregnant people. So I think that is a really cool thing about this vaccine and the rollout and the data collection. Historically, almost all of our side effects from a vaccine will show up within about 2 months, and rarely do we ever see anything as far as a year out. And so we are past that point. There are a few rare side effects, but really not too far above the number we see in the general population. I was just looking up current effectiveness of the vaccines, and it looks like we started at greater than 90% efficacy with the alpha and beta variants that we had, and Delta, as we know now, is the variant that's causing all of the problems across the world and in the US. It's more easily transmitted, and it's made younger and healthier people more sick than previous strains. But we're still sitting at like 88% effectiveness for Moderna and Pfizer against any symptomatic disease, and then like 96% effective against hospitalization. Johnson & Johnson's about 71% effective against hospitalization and 95% effective against death. So those are still pretty good. Just for comparison, the flu shot each year ranges from 40 to 60% effectiveness, with only like 10% effectiveness in 2003. So we're far above effectiveness of the flu vaccine. And then just some local statistics, 78% of our patients that are hospitalized at Intermountain right now with COVID are unvaccinated. 84% of the ICU COVID patients are unvaccinated, and 87% of the patients on vents are unvaccinated. And then I know Dr. Johnson has some further information on that.
Yeah, and SheriDawn, thanks for sharing that those statistics right in locally as well. So an interesting comment too, and something that oftentimes people have brought up. I think I've been hit with this several times. It says, well, what's happening in Israel, right? I don't know if anybody knows this, but and my data might be a month or so old. But if you look at what's happening in Israel, and the reason why this is relevant is because a large proportion of individuals in Israel have been vaccinated. They're probably one of the most aggressive vaccination approaches ever. I think more than 80% of the people in Israel are vaccinated. And if you're looking at the 60 and older population, they're like 90-95% vaccinated. And what they're seeing in Israel right now is that, SheriDawn shared this information, and I've forgotten already your numbers, but it's overwhelmingly unvaccinated people that are in the hospital. In Israel, it's actually not the case. About 60% of the people in Israel who are in the hospital right now are vaccinated. So it's a 60-40. And interestingly enough, though, if you look that might give individual people have used that data to say, hey, the vaccine's not working. Look what's happening in Israel. But as it turns out, this is a great illustration of a concept that we teach in our introductory statistics classes called Simpson's paradox, where the confounding variable, an additional variable, if you don't take it into account, can flip the relationship, sometimes even give you the opposite answer. And this confounding variable is the variable of age, because as it turns out, 60% of people in the hospital are vaccinated, but 80% of the population is vaccinated. And so you've already see a difference there, right? Is there should be, if it wasn't working, there should be 80% of the people in the hospital should be vaccinated. And the thing is COVID, it's especially severe COVID, impacts older people. And so this variable has flipped the relationship. And so most of the people that are most likely to get COVID are older people, but most of them are vaccinated. And so what's happened is that if you don't account for age in your analysis, it looks like the vaccine is not very effective because it's a 60-40 switch. But if you account for age, what you find is that even in Israel, this 95-96% effectiveness that SheriDawn is showing shows up if you look at stratified age groups on their own. And so the vaccine is working in Israel, and it is providing 90 to 100% efficacy against severe disease in Israel right now, if you consider age in your analysis. And that really is what's happening. And it's interesting too, I see Intermountain Healthcare, I've been watching their statistics, and they've actually only recently started including age. And I think SheriDawn's statistics probably aren't accounting for age. And so if she did account for age, you probably actually see that the numbers would be more convincing in that context. And so anyways, that's the thing, is that you oftentimes have to be very careful about your source and consider other factors, because the data can be manipulated and interpreted inappropriately.
Professor Neilson, Dr. Johnson, thank you so much. Dr. Johnson, there was a quick question in the chat. What about India? Is that the same situation? Is it possible that the data is not accounting for different variables? And I'm not sure the story on India. So if you understand it, maybe give a little background.
Yeah, and I haven't looked at that much of the India, so I don't want to go too far out.
Okay.
India's I think their vaccination rates are a lot lower though. So, so again, something I'll go look up. Okay,
well, that's a great question that we'll go explore and continue to learn more about this disease as it affects different countries. So let's go to our third question. And Dr. Gold, this goes back to you. And this was actually a question that popped up in our chat as well, is if mRNA viruses don't have part of that virus, or vaccines don't have part of that virus, why do some people still get sick after they're vaccinated? And can vaccinated people still spread the virus?
Okay, very good. So as SheriDawn mentioned, the Pfizer and Moderna vaccines have been shown to be about 88% effective or so. What that means is that, 88% of the people who receive both doses will mount a very strong immune response and will be protected from exposure to the virus. And unfortunately, that means that 12%, approximately 12 people out of every 100 people who are vaccinated, for some reason don't respond properly to the vaccine. They simply don't make the antibodies, or they don't activate the T cells that are needed to fight the virus. And there are a few different reasons why someone may not respond effectively to a vaccine. One is genetic variation in our own immune system. We all look different because of genetic variation. Some of us have blue eyes, some of us have brown eyes, and so forth. That genetic variation also affects our immune system. That means that some people may just not be able to respond as strongly to any given vaccine. With their genetic makeup, their cells simply lack the ability to recognize that specific portion of the spike protein that's encoded by the vaccine, and so their immune system just isn't activated. The second reason someone may not respond is due to a compromised immune system. Maybe somebody has a pre-existing condition like cancer or autoimmunity or chronic inflammation, or maybe they're taking drugs that suppress the immune system. These conditions can prevent the body from responding to a vaccine. And as Dr. Johnson was talking about, it's important to note that there's some components of the immune system actually start to atrophy, to fall apart as we get older. The thymus is a gland above the heart, which is responsible for the development of T cells. And it starts getting smaller after puberty. By about the age of 65, it's shrunk down to almost nothing, meaning that elderly people don't make new T cells, and they're at an increased risk for disease even after getting vaccinated. A third reason someone may not respond is due to genetic variation in the virus itself. We've mentioned variants. It just turns out that one of the enzymes made by the virus, when it is in our cells, which it uses to replicate itself, is a very sloppy worker. It works very fast to make millions of copies of the virus's genetic information, but it tends to make a lot of mistakes as it does so. And some of these mistakes will change the shape of the spike protein just enough that the antibodies we make in response to the vaccine are not able to recognize the variant. It's kind of like the virus becomes disguised and our bodies simply can't recognize it well enough to fight it, even though we responded well to the vaccine. So these are just really kind of some of the reasons why it's so important for everyone to be vaccinated. If the overwhelming majority of people are vaccinated, it becomes increasingly unlikely that an infected person will come in contact with a susceptible person. So those who are unable to respond to the vaccine are still protected, but they're protected by the wall of vaccinated people around them. They're protected by the herd, if you will. This is why vaccination really needs to be a whole community effort rather than just an individual effort. We really do need to reach levels like 90-95% immunization rates to achieve true herd immunity. And the longer we wait to receive those levels, the more and more likely we're going to create new variants that are going to make it less and less likely that we can eventually eradicate this virus. As far as can a vaccinated person still spread the virus? The first time you're exposed, whether to a virus or its vaccine, it takes about 14 days for the immune system to learn how to recognize and fight that virus. But after you've been vaccinated, it takes about 4 to 5 days before we see the maximum response of our body to that virus. And so when you're first exposed, you really have about 2 to 4 days where, yes, the virus is replicating in you and can be spread, even though you may not feel symptoms, you don't even know you're sick. So this really tells us why, with less than 58% of adults vaccinated in Utah, it really is crucial that we're all vaccinated and, frankly, that we even continue to wear a mask to protect those people around us who are still susceptible. Once we get to higher levels, like 95% vaccination, we can stop that sort of thing. But yes, we can still spread it for those first 2 to 4 days before our body is effectively mounting its attack.
Thank you, Dr. Gold. That kind of leads us into the next question, and that's if I've had COVID-19, do I still need to be vaccinated? And you kind of touched a little bit on, if I've been vaccinated, why am I still asked to wear a mask? And Professor Neilson, would you take this question, please?
Yeah, absolutely. If you've had COVID-19, do you still need to be vaccinated? So COVID infection basically has like kind of 3 outcomes in the end. And Dr. Gold and Dr. Johnson can probably speak to this on a more cellular level, but basically you can develop no antibodies. We know that happens. About a third of people, it seems, develop no antibodies, and the rest of people will develop antibodies. However, we do know that in some people, it seems to be a decent proportion of the population, those antibodies will kind of wane within about 60 days. And an unknown percentage of the population develops really great antibodies. So it's just kind of a gamble in which one you're going to be. Reinfection rates also suggest that infection with one variant doesn't necessarily protect against the other variants, but we are seeing protection with the vaccine against multiple variants. There are a few studies out there that haven't really been peer reviewed yet, that are kind of waiting for that process, that suggest the combination of COVID infection plus vaccination produces the best overall immunity. They don't recommend going out and getting COVID infection and then getting vaccinated. But if you have had COVID, they still recommend getting the vaccination because that actually gives you what appears to be the best immunity overall. And then, yeah, with the wearing the masks, you still have that 12% chance of reinfection with the 88% efficacy. You can still spread that to others if you're sick. And just by masking, you're helping control those secretions, those droplets that might infect other people. And just as a sad story, as I'm a practicing person, I have a friend who works in a COVID unit. And one of the saddest things she sees is family members who know that they were the ones that got their family member sick. And just the heartbreak that they experience watching their family member die, knowing that they were the ones that were sick initially. And kind of the after effects of that has been devastating for families and for healthcare workers.
Thank you, Professor Neilson. Dr. Johnson, I have a question for you that, and I know we're not in number 5, but I'm going to take a little bit minute. I've had COVID-19. I had COVID back in January. I got vaccinated. I'm a long hauler. Unfortunately, the vaccine actually helped my long haul symptoms, decreased the frequency. So I'm very grateful for that. But my follow-up was this, is now we've got the boosters, and someone also asked this question in the chat. And so I'm curious if maybe you could address the fact we've got some booster shots out there, and they're talking about combining the boosters. What's your thoughts on that? I was J&J, and I'm thinking of maybe doing more Moderna once it gets approved. What are your thoughts?
Yeah, so that's an interesting point. And talking about this idea of immunity, hybrid immunity, and even those that had COVID and whatnot, when you have COVID, the response that you build to fight it off could be very different. In fact, I'm doing this research study where we're looking at different pieces of COVID that people react to and their reaction. And so people who have had COVID have a very heterogeneous response, meaning Dr. Gold talked about the spike proteins that the vaccine targets, but you could actually develop immunity to other pieces of COVID. And so then adding the vaccine to that could enhance your body's ability to recognize the spike protein and other parts of COVID in more effective ways. So you can double your immunity, right? You have 2 ways of fighting that virus. Now, so doing these different boosters could potentially do the same thing, right? Is that maybe you now have 2 mechanisms to fight it. Now, most of the vaccines are targeting the spike protein, and so I don't know, and I haven't really studied the research, and I think we have more research to do of whether, is it better to get a booster of a different kind than or just get another dose of the same thing. I don't know if the research is really mature in that area, but there's the potential that you could enhance your ability to fight COVID by adding those multiple avenues for fighting it away.
Thank you, Dr. Johnson. I'm actually going to go back to you, and I know we're running short on time, so if you could keep an answer as quick as you could, and this is probably a horrible way to say it, but there are just so many unreliable sources out there of information, a lot of misinformation on social media and different platforms. So we want to help individuals be educated and go to the best sources of information. Where do we find reliable information?
Yeah, and this is an awesome question. And I think and looking at our university's response to COVID as well, is that our SUU is putting a lot of responsibility on us as individuals. They're not mandating vaccines. They're not mandating masks. They're making individuals choose. And so individuals, I think that puts the responsibility on us to be well informed and well educated. And I think it's an advantage if we do that, right? As I really like that freedom that the university has given us, but it does put a lot of responsibility on us. I would say this: there are some great sources out there, and looking for the most unbiased sources as possible, I think is important. And I would say there's a lot of ways to do that, but 3 principles here: learn how to read a scientific study. That's something that you need to do so that you can see for yourself what those studies are actually doing. Number 2, know the biases of your sources, right? If you're getting it from Fox News or CNN, they're going to have a different attitude and a different approach. And sometimes these news agencies and these pundits that speak have biases, and you need to know their biases. And then the last thing is know your own biases. Mm-hmm. Don't come into the study thinking, I want to validate what I already believe. Come in with an open mind saying, what does this scientific study tell me? What can I learn from it? And how can I then synthesize it? So I would say do that. And if you do that, you can get your information from almost anywhere, as long as you're really taking those 3 principles and trying to understand them very well, and get the best information possible.
Dr. Johnson, thank you so much for that answer. And I'd like to just thank Dr. Gold, Professor Nielsen and Dr. Johnson again for wonderful answers and really taking on this fun and exciting topic of vaccines. And for the participants, thanks for joining us today. And I really hope that you get some good nuggets of truth and some good nugget of evidence to help you make decisions. Just a reminder, this panel has been recorded and it's going to be uploaded on SUU's website. And also there is a student vaccine clinic on campus next Tuesday, October 26th, 8:30 to 11:30 in the Cedar Breaks room in the Student Center. And it's free of charge. You don't even need your insurance. So I hope that this information was valuable as you go and make a decision about being vaccinated or not. Again, thank you for participating and thank you, Dr. Gold, Professor Nielsen, and Dr. Johnson.